Hi, my name is Debrina and I am a speech-language pathologist here at God PPEC. Today, I will be discussing feeding therapy and some signs to look out for to determine if your child may be a candidate for feeding therapy. At our center, we have a variety of children who range on levels of abilities. We treat children with low birth weight, cerebral palsy, G-tubes, and so much more. One of the most prevalent symptoms that occur with our kids is associated with feeding difficulties. Our speech team has had great pleasure to commit to our special population by actively taking courses and trainings to enhance our insight on feeding and sensory food play. Feeding therapy can be addressed in many ways, and it can look different for every individual child. We make sure that we cover it on all aspects. This could be physiologically, behaviorally, and even structurally. Let's take a look on how feeding specialists could be the right option for your child. What are some signs to pay close attention to when it is time for your child's feeding? In good SOP fashion, here are a few WH questions to help us understand more on the topic. How are they feeding? When are they feeding? What are they eating? Why they are eating? Where they are eating? And you can even assess your child's feeding skills by who they eat with. If your child has had choking, gagging incidents, meltdowns during mealtime, avoiding different textures, flavors, and food groups, avoiding eating areas such as tables and high chairs, kitchen-like areas, have had significant weight gain or loss, nasal reflux during feedings, difficulty managing their foods during feeding time, or possibly difficulty transitioning from solid foods. If your child has experienced one or more of these occurrences and it is affecting their feeding skills, it may be time to contact a professional. These signs may or may not be seen together, but your child still may need help to better their skills. When you think of feeding problems, you may attribute that to food refusals and picky eaters. You're right. This is not so uncommon for our special population. With behavioral feeders, you may see gagging, vomiting, throwing foods, or pushing foods away. They may even be sensitive to sensory stimulation during mealtime. Children with feeding problems often develop negative emotions triggered by mealtimes. Occupational therapists and speech therapists will collectively come up with a plan to desensitize sensory issues with your child. If a child has physiological issues, you may see trouble with manipulating their foods. Here, you will see issues with chewing and swallowing. Some children may have difficulty with transitioning to solid foods from bottle feeding or G-tube feedings. Oral motor intervention or play-based feeding can be targeted for the needs of each individual child. We do various oral motor exercises to strengthen the muscles around the mouth, and tongue exercises to help in developing coordination and control. We strive to improve oral motor skills and enhancing the overall abilities of each child. Structural issues that may affect feeding could include variations of the palate, tongue tie, or short frenum. Your therapy team will recommend them to see other specialists who attempt to correct this issue. At GTG, we collaborate with different disciplines to better align the children to enhance their feeding experience. We step in to attempt to alleviate the stress associated with feeding. Feeding therapy is different for every child and must be assessed properly from a qualified therapist in order to attain positive outcome for your child. Stay tuned for part 2 on how GTG uses sensory feeding play groups to help our kiddos. Thank you all for watching and stay tuned for our next video.